This skill is wound packing and wound irrigation. It's going to be done in two parts. So the first part, you're going to see me take the old dressing off, do an assessment, and then actually do the irrigation. And then we'll come back with the second part where we actually do the packing and putting the dressing on. The first things you want to look at here is to go to the chart. You should definitely have an order from the doctor to tell us what we're going to be packing it with, what we're going to be cleansing it with, and especially how often we're going to be doing it. It's important that the gauze that's inside the wound, because usually this is an open wound that's not approximated, it's healing by secondary intention. This wound usually is open, and it's important that it heals from the inside out. What will happen is if we put the packing in and leave it for too long, it'll dry out and pull too much of the good tissue out with the bad tissue. Because the whole idea behind the wet to damp packing is that it'll dry just enough that we can pull the old tissue out when we change out the packing, not the good tissue. What we're going to do right now, though, is go ahead and we've checked the chart. We've looked for the order, the change of dressing, what to pack it with, what to clean it with, how often we should be doing it. Most important to look how he's been tolerating, because this is Mr. Fay again, even though I just have part of the body here. It's important to take and look and see, do they need pain medication? Because this usually can be very painful. So you want to give them a pain medication and wait 30 minutes to an hour for it to kick in. Also, you want to look again at allergies, especially the latex and the tape allergies. You also want to look at any contraindication on any of the dressings that we might be using. Once you've done that, then you can go ahead and you can take and come out and wash your hands. And what you want to do is get an irrigation basin and tray. It'll have a syringe and something to hold your water in. You want to get a bottle of normal saline. And you want to get an MS basin, and you want to get something, usually a linen saver, to put under them because it can get pretty wet under there. You also want to take and get a couple of 4x4s because you want to dry what we call the peri wound, and I'll show you what that is in just a little bit. And then you want to have some non-sterile gloves. All right, so we're going to go ahead. We've come down to the room. We've identified the patient. This is Mr. Fay. We've explained what we're going to do. We're going to provide definite privacy here because of it's on the buttocks area, the coccyx area where we're going to be working. So we want to make sure and give privacy. You definitely want to make sure and identify and check allergies. Okay? Now, once we've done that, then we can come on over and we'll get our non-sterile gloves on and we'll position the person on their side. If by chance they want to know a little bit about what's going on, since this is on the back, we certainly can do some educating, and again, I may do some educating as we go along. Okay, again, we're going to pull the tape off, and you want to pull it towards the incision here, in this case towards the opening. Again, we shouldn't have a lot of drainage. This is our secondary dressing. This is our primary dressings down here. Here's where we'll start seeing some of the drainage itself. Now, when you pick this up, be very gentle. You want it to debride by pulling out the dead tissue, but not the good tissue. Very gently, because sometimes this can really hurt the patient. Okay, again, I've assessed the drainage here, the color, the amount, any specific odor. You want to take and pull the glove, again, inside out, over top of that to contain all that drainage. And again, what I'm going to look at here, I can do Rita and salt here. It's just the approximated part, the A on the end of Rita, we would not be able to do. So we're going to look at redness. Pink is good, and reddish pink is very good. By fire engine red usually is a sign of infection. This part here is the peri wound outside, the peri wound. That we want to keep dry, and we want to keep that as good as we can. But we've got redness, we've got edema, we've got ecchymosis, and we've got drainage. We won't have the approximation with this. Salt, we've got the size, which we would take and measure. And usually we use it like the face of a clock, and we measure that way. We've got the appearance, which is the Rita minus the approximation, and we've got the location, and then the tolerance, and then the treatment. Okay, so that would be your assessment there of the wound itself. Now, what we want to do, if they haven't got the linen savers under them, you want to make sure and put that under them. Most of the time, we'll have another basin, not the same one they brushed their teeth with, a separate basin, and that we'll put here to try to catch some of the saline. Okay, we want to come over here, and you want to go ahead, and when you open up your irrigation tray, it should be sterile. Though I must say, wounds that are decubitus wounds, bed sores, decubitus ulcers, They are not considered sterile. They're considered chronic wounds. They're considered just a clean technique that we use with them. Okay? Now, what we want to do here when we reach in, I'm just going to grab the outside of this, not the inside, because the syringe itself on the outside doesn't have to be sterile, but the solution has to be sterile that we're going to be using. Because even though they're considered chronic wounds, we treat them here in the nursing program when you're checking off as sterile wounds to get you more practice. Okay, I'm going to go ahead, open the bottle after I palm the label of saline, upside down cap, and yes, it is a new bottle. Okay, go ahead and lip the bottle here. Then I can pick up here and pour my saline in. And you might want to put about 1/3 of a thing of saline in, okay? And then put this back down. But don't have your hands touching down on the syringe. It's going to go back on the inside. Okay? All right. Now, at this point, you don't have to put sterile gloves back on because what has to be sterile has to be the solution on the inside. Okay? So I'm going to go ahead, though, and put this on. Before I do that, though, I want to talk to you a little bit about this. When you get ready to irrigate, you're probably going to splatter. So you need to have a face shield and a face mask. And if you think it's going to splatter a lot, even a gown to protect your scrubs. I'm not going to put on the face shield because I won't be able to talk to you if I do that. Okay? And since I'm going to take and do the irrigation, I am going to go ahead and put on my gown. And most of the time, you can either do this before you take the dressing off, or you can do it after you take the dressing off. It's whichever you prefer to do. But you should do it before you actually start your irrigating, because the whole idea is to protect your uniform or your scrub, whichever you're wearing. And I would have my face shield and my mask on, except for when I'm talking to you. All right, so we're going to go ahead and put this on. Okay. We're going to go ahead and draw up our saline. Now, we want to keep all of this sterile here. And as we come down here, hold the basin as close as you can. The most important thing is I want to go from least contaminated to most contaminated. I hold my syringe approximately 1 inch from the source right here, and I just go down. And if you watch, I think you'll be able to follow me with this. Okay, we're going to go down. Now, when I start back up, I move around, go back up, and start. And it flows from least contaminated to most contaminated. I would not want to start at the bottom and work my way up, because then you've got dirty saline running back over your cleaned area. So go to the top, irrigate, and irrigate you see no more debris, dead tissue coming out of the wound. Okay, so it looks pretty clean now. We'll put this back, and all of this now will get tossed. That will be tossed. Okay. Now at this point, I'm going to open these up, and these don't have to be sterile because what I'm going to do is clean around that edge, the outer edge, which that is not sterile in itself at all. But we want to keep that peri wound dry. Since I'm standing this way, I'm going to start at the top, work my way around, throw this one away, because I don't want to take and be going uphill, dragging over where the saline solution could come back down into my clean. Again, start and wipe down. If I feel like I need to wipe again, I would get another 4x4 out. Now, at this point, what I would do is clean this up. If I made really saturated here, I might even change this out. And then I would get ready to set up my sterile field to do my actual packing. Okay, this skill is wound packing.
So yun, magandang araw sa inyong lahat mga bunso. So sorry kung hindi ako naka-attend kanina due to nag-vaccine kami ng baby, and ngayong hapon mayroon kaming vaccine ng Sputnik for first dose. So yun mga bunso, may idea na kayo kung ano yung ating topic for today. So, di na tayo magtagal para mabilis ang usapan. Let me share this. Now, so our topic for today, kanina si Ma'am Badet, di ba? So our topic for today is all about wound irrigation. So, thank you Ma'am Christina Mayo sa slides po. So, ano ba ang definition, the best na term for wound irrigation? The steady flow of a solution across an open wound surface to achieve wound hydration, to remove deeper debris and to assist with the visual examination. An irrigation solution is meant to remove cellular debris and surface pathogens contained in wound exudates or residue from topically applied wound care products. Is considered also to be the most consistently effective method of wound cleansing. So, yan mga bunso sabi, most consistently effective method para linisin ng sugat. And is the act of flushing a wound with a gentle stream of liquid in order to remove dead or necrotic tissue. Ayan po yung mga namuong dugo or kumbaga di ba pag nag-heal na yung sugat, yun nakikita niyo yung nagbuo-buo. So yan yung ibig po niyang sabihin. Then one type of wound that often undergoes wound irrigation is an ulcer. Hindi po yung mga peptic ulcer ha. Yung ulcer na madami po kasi ibig sabihin yan. Itong ulcer na to siguro layman terms, layman ba? Basta yung madaling sabihin, bed sores po, bed sores. Pag matagal like mga bedridden, usually pag matagal na po kasi sila nakahiga, nagkakaroon po ng ulcer, mga bed ulcer, bed sores. So irrigating ulcers to remove this dead tissue can help them heal more quickly. Pag nasa tamang pangangalaga po ang mga bed sores, gagaling po yan. Pero pag wala pong assessment dyan, tapos walang intervention, mas lalala po yung sugat na yun, baka mas malalim pa po. So, kailangan nating mag-wound irrigation po dyan to help them heal more quickly, sabi niya nga. So, what are the purposes? To remove the following, like cellular debris that is loosely clinging to the wound, ganyan. Surface bacteria, nakakalinis din po siya para ma-prevent natin ang infection. Wound exudate, dressing residue, pag dumidikit yung mga dressing, syempre kailangan malinisan din po yan, mga residual topical agents, yan po yung mga pinapahid na ointment. And to assist with the maintenance of a moist wound environment, facilitate debridement and boost wound healing. Excuse me. So, what are the fluids to use? So, di ba sinabi, wound irrigating. So, may irrigation, kumbaga, may gagamitin po tayong solution to cleanse the wound. So, pwedeng water. Water is very accessible. Walang bayad. May bayad siya usually pag ganito, di ba? Nakagripo. Pero meron din yung nakapost, ganyan. Ayun, basta very accessible po siya pag water. And therefore, very easy to use for wound irrigation. Di ba usually pag nadatapat tayo, agad natin hinugasan para ma-prevent natin infection, ganyan. So, ito yung very accessible pag water. Pero kung mas gusto mo pang like yung mga malalalim na po, like ulcers and bed sores, kailangan na po siya ng mga more on aseptic technique or kailangan need na natin ng mga isotonic solution, ganyan. Like normal saline or minsan ang ginagamit po kasi natin mga nurses like yung plain NSS, ganyan. Meron din po mga normal saline, sterile water, ganyan. So normal saline is the most common fluid used in wound irrigation since it does not have many side effects and it does not alter the normal healing of the wound. Normal saline is an isotonic, ayun ang sinabi kanina, isotonic solution, meaning it has the same osmotic pressure as bodily fluids. Then, meron po tayong hydrogen peroxide, helps to kill germs and bacteria while flushing the wound. However, its use is controversial because there is some evidence that overusing this solution may slow wound healing. So, usually, ang in-order naman ni Doc is yung normal saline. Bihira lang po yung hydrogen peroxide. Usually, siguro pag first na ng sugat, yun yung ginagamit. Then, and later on, after ng hydrogen peroxide, ituturo mo na yung saline solution. Ganun lang na mga bunso. Yeah. Then, what are the key points? Wounds that are actively bleeding heavily should not be irrigated for it. May dislodge clots that are forming. Oh, so yan, wounds that are actively bleeding. Pag nagdudugo-dugo pa yan, usually hindi mo na po advisable tong wound irrigation kasi nga baka mamaya may na-hit po tayo or through water, hindi natin mapansin po ano po yung lumalabas pa doon. So kailangan mag-clot mo na yung blood or hindi mo na siya mag-bleed para ma-perform natin yung wound irrigation. Then wounds should be irrigated every time you change the dressing and upon initial assessment. So wounds should be irrigated, sabi niya, every time you change the dressing. So kailangan, kasi usually, di ba, pag may dressing yan, didikit yan sa sugat. So kailangan, ini-irrigate po natin muna ng kunwari, water na lang muna, water. 2, para malusen natin yung dressing, para upon removing the dressing, hindi yung sugat mismo yung mahila mo, kasi meron yung cases na mga ganun po, di ba? Pag hinila mo yung dressing, biglang nagdugo. So, imbes na pinapandali natin yung healing, baka mapoprolong pa. Then, kailangan assessment. Always remember that bago nyo tanggalin yun, i-assess nyo muna kung ano yung mga nararamdaman ng patient, kung may lumalabas bang mga nana, basta assess nyo yung surroundings ng kanyang sugat. Then, sabi dito, normal saline is the most frequently used irrigant. Ayan, most frequently used mga bunso, ha? Then, however, there is evidence that tap water may result in faster wound healing provided a clean water source is available and tap water is also far more cost-effective, sabi. So, what are the key points na continuation? Pressure is the key to effective irrigation. Too little pressure will fail to remove surface bacteria, which may lead to wound infection. So, too much pressure can actually force surface bacteria into the wound bed, in addition to the damaging delicate granulation tissue. Irrigation pressure should be between 4 and 15. Then, wound irrigation may be performed alone or in conjunction with other modalities such as whirlpool. Yeah. Then be careful to allow the solution to flow from the cleanest to the dirtiest. Di ba pag cleanest sa gitna? Then dirtiest yun yung sa surroundings na. Do not force irrigant solution into any wound pockets or areas of tunneling. So debridement. What is debridement? Debridement is the removal of dead or necrotic or infected skin tissue to help a wound heal. It's also done to remove foreign materials from tissue, sabi niya dyan. The procedure is essential for wounds that are not getting better. Usually, these wounds are trapped in the first stage of healing. When bad tissue is removed, the wound can restart the healing process. So, kailangan tinatanggal po natin, pag debridement, ayan po yung pagpatanggal po ng mga dead or infected skin tissue. Yan po yung mga nag-black na. So, kailangan tanggalin po natin yan to restart the healing process. Sabi nga dyan. Part po yan ng ating paglilinis. So, what are the purposes of wound irrigation? Common sense, di ba? Kaya nga sabi, wound irrigation to help healthy tissue grow. Ibig sabihin po yan, pag proper po ang ating wound irrigation and daily, mas mapapadali po natin paggaling ng sugat and pag-grow ng tissue. Then minimize scarring. Hindi na po lalala or lalaki yung sugat. Then reduce complications of infections. Most importantly, kasi risk po sila sa infections. Anytime pwede po silang kapitan ng infection pag di nalinisan. So, what are the procedure? Like guys, sa video, ginather niya yung kanyang supplies like syringe. Yung syringe niya, yung 50cc, right? Sa ating kasi, pag hindi naman available, napakaano naman natin mga nurses, kukuha tayo ng mga, yung tawag siya, yung 10cc. Siguro, no, pwede na natin, pag hindi available 50cc, gagawa tayo ng paraan. Then yan, cannula with needle nest adapter, like ganito. Di ba syringe yan? For example, ito yung yung 10cc ko or 50cc. Tatanggalin lang natin needle. Then, irrigation fluid. Yung fluid, like yung normal saline, ganyan. Kung ano yung order nito. Kunwari, example, ito naman yung example ko. Then, dressing, ayan, waterproof pad. Yung pang-drape natin sa patient as well as sa gagamitin natin. Then, basin. Yung kidney basin or kung anong basin na available sa inyo. Then, dressing tray with sterile forceps, scissors, skin barrier protectant. So, yan yung mga kailangan po. Para yun yung tatanggalin natin for debridement. Diba? Kailangan po natin yan. Then, skin barrier protectant, cotton tip applicators. Yan po yung panglinis po natin mamaya after the irrigation. Then, measuring guide. Sabi niya, outer sterile dressing and packaging and packing gauze or OS or packing as per physician's order. Yan po yung mga gauze na pang cover po natin kung in-order po ni Doc. As needed lang naman po siya. So, first, perform safety steps like number 1, perform hand hygiene. Then, check the room temperature and hazards. Titignan nyo po kung safe ba yung room na gagamitin. Then, kung malamig ba o mainit o katamtaman lang. Tapos, introduce. My name is Maria Cristina. I'm your nurse. Good morning, ma'am. Good day, sir and mama. Ako po pala si Tina. Nandito po ako ngayon. Napag-utusan po ako dito na tinisan po ang iyong sugat. Ngayon po, mahingi ko po ang iyong opinion kung aware po ba kayo sa gagawin po nating procedure ngayon. Ganyan. As in, explain niyo po sa kanya to ma-provide yung comfort kay patient na hindi sila bigla-bigla nagugulat or matatakot sa gagawin nyo. Then, saglit lang po ito, ganyan. Kailangan bigyan mo pa rin siya ng time range para hindi siya mag-antay na matagal or baka isipin niya matagal yung procedure. Then, confirm patient ID. Confirm nyo po yung name ni patient, then ang kanyang birthday. Then, pag na-verify niya, check nyo po yung ID band, kung meron siyang ID band. Then, explain the process to the patient as if they have any questions. Magtanong kayo kung may mga questions po regarding sa procedure. Then, be organized and systematic. Kailangan po, well-arranged po tayo. Nursing is an art, mga bunso. So, kailangan maayos lang iyong kagamitan when it comes to perform your procedure in front of the patient. Then listen and attend to patient cues. Yan, kailangan maging attentive tayo. Kailangan may care pa rin tayo sa kanilang dinadamdam or mga kinakatakutan. Then ensure the patient's privacy and dignity. Yung pag niya ng curtain, di ba? Then, ayan, bumalik. Wait lang po ha. Yan. So, confirm the provider order and verify appropriate of order according to the wound assessment. So, i-verify nyo muna sa doctor's order kung ano po yung gagawin nyo procedure sa kanya, kung siya ba talaga yung bibigyan po ng wound irrigation or ng wound care. So, prepare the environment, position the patient, adjust the height of the bed para sa body mechanics, and turn on the lights, ensure proper lighting to allow for good visibility to assess the wound. Yan, sabi nga body mechanics, and comfortable position for the patient. For example, nagkaroon siya ng bed sore sa likod, malapit sa kanyang buttocks. Ayan. So, kailangan naka-prone siya, di ba? So, i-instruct nyo lang siya, then if possible to allow the solution. Yan. Position the patient so the wound is vertically to a collection basin if possible to allow. Hindi na pag prone, mahirap pala pag So, kailangan lateral pala siya mga bunso, naka-lateral. Para pag nag-wound irrigate pala tayo, makakatch po ng basin. Gaya nga nung ginawa, di ba, nung nurse sa video. So, binigyan ko kayo ng introduction para for you to imagine kung paano yung gagawin natin. So place a waterproof pad under the patient to protect the patient's clothing and bedding from irrigation fluid. So ilalagay po natin yung pad mismo sa kanyang side kung saan tayo mag-i-irrigate. Then perform hand hygiene, apply clean gloves. So depende na naman po yan kung ano po ang prefer na agency protocol, like kung gusto nilang clean gloves. Pero pwede din po sterile. Nasa agency protocol po yun. Then, remove outer dressing. Using sterile forceps. Ayan, forceps. Meron po tayong forceps. Parang gunting po yun, forceps. Then, remove the inner dressing, packing from the wound. Pag sticky po siya, basahin nyo po siya. Gaya nga ng sabi ko, basahin nyo muna. Kunwari, ganyan. Na-open na natin yung mga packs. Kunwari, ito na yung sterile water, ganyan. Ito yung syringe. Tapos, for example, ito yung sugat. Yan. For example, ayan. So, kunwari, nakapack siya. Ganyan. Ito yung sugat, for example. Yan, nakapack. Madikit. So, kailangan mag-aspirate muna tayo ng sterile. Then, basahin muna natin yung gilid. Then, unti-unti nyo pong tanggalin. So, maano yun din yan. Tapos, habang ini-irrigate nyo, pag unti-unti po natin siyang hilain. Hindi yung basta hila. Kasi basta hila, baka mamaya, yung namuong dugo, pagkahila mo, baka mamaya nag-bleed pa yung sugat, imbes na nasa healing process na siya. So, ganun lang. Unti-unti nyo lang. Then, discard yung first na niya. Then, nakita nyo yung sugat. For example, ito yung sugat. I-irrigate nyo lang siya, mga bunso. Ganyan. Mag-aspirate lang kayo. Aspirate. Then, irrigate. Irrigate. Yung guys sa video, irrigate nyo lang yung sugat. Kasi usually, ito naman affected area pag ulcer. Yan. Irrigate nyo lang yan. Para yung mga debris or mga dumi na dumikit ay ma-flush. Then, mag-ano pa kayo, mag-aspirate din. Gently. Tapos, ayan. Pag napansin nyo, mayroon pang buo, mag-aspirate lang. Ganyan. Ganyan. So, yun. Basta yung yung solution, kailangan makatch po siya ng basin para hindi tayo magkalat sa patient's bed. Kaya nga may drape din tayo para tagasalo din ng mga natatalsikan, no? Then, sabi niya, confirm the quantity and type of packing are the same as recorded on previous dressing change. So, kailangan yung dressing na gagamitin din kasi kailangan same width, size nung sa una. So, pag napansin niya na okay na, next. Yan, note the location and type of the wound. Ganyan. So, kung na-advance ko na kanina kasi usually mas mabilis kasi pag mabilis ako mag-ano, di ba? So, sabi niya dyan, assess the wound. Note, kasi, sorry mga bunso ha, medyo napadali ako. Sabi kasi, before, during, and after of the procedure, kailangan meron pa rin po tayong assessment. And ino-note nyo po lahat ng manonote nyo po dun. Sabi nga dyan, assess, di ba, after yung pagkatanggal no first na gauze, sabi niya, note the location and type of the wound. Measure the wound's length, width, and depth, kung gaano kalalim, and under mining or tunneling are present, note the location, measure the depth, sabi niya. Determine if the level of tissue damage indicates wound healing or worsening. Kung may progress ba yung pag-heal or mas lalong lumala. Then assess appearance of wound bed, noting color, or may odor pa minsan niya. Minsan doon sa side niya mainit, may redness, ganyan. Then wound assessment helps identify if the wound care is effective. Always compare the current wound. Kailangan compare nyo para alam nyo kung talagang nagpa-progress ba yung pag-healing or may delay. Baka kasi mamaya may signs of infection na pala pag hindi siya gumaling. So, apply ng sterile gloves, gown, and goggles before you perform this procedure nga mga bunso kasi depende naman sa agency policy yan mga bunso kasi may tendency na matalsikan ka or may tendency na mag-spill nga kung saan-saan. So, protection mo na din yung mga bunso. Then, if irrigation is indicated, fill a 135 ml syringe. So, sa atin kasi, bihira lang naman ng ganyan, lalo na pag sa public. Pag sa private, always, meron yung ganyan. Then, and attach a needle nest cannula to the end of the syringe. Ayun yung sinabi ko kanina. Kailangan pala mga bunso, dahil may protocol po tayo na mga aseptic technique, dapat yung needle, since hindi nga sterile tong outside, kailangan wag nating matouch yung sugat when it comes na mag-irrigate tayo ng sugat. So, ganyan, mag-aspirate ka lang, then 1 inch yung layo or pagitan ng syringe between the sugat para pag nag-flush tayo ng ganyan, di natin siya matouch. Ayun nga yung ina-avoid natin para hindi po ma-infect or malagyan pa ng dumi mismo yung sugat. Yan. Dry wound edges with sterile gauze using sterile forceps to prevent maceration of surroundings tissue from excess moisture. Then remove after the procedure. Inspect mo ulit kung may dumi pa. Kung wala na, kung ano po yung order ni Doc, kung kukoveran pa or hindi na. Then, kunwari sinabi coveran, apply mo lang yung gauze. Then, kung lalagyan pa ng tape or hindi para hindi matanggal yung OS, ganyan. Basta, kung ano yung order ni Doc, ayun lang po susundin. Hindi yung gusto mo ang masusunod. Hindi ka doktor. Nurse po tayo, nurse. Then, after the procedure, remove goggles or face shield and gloves. Perform hand hygiene, apply sterile gloves. Sabi niya. Or non-sterile gloves if using sterile forceps. Yan. Ayun na po yung sinabi ko kanina mga bunso, Yan, I will send the PowerPoint. Mabilis lang siya gawin. Yan. Maintain sterile moistening gauze. It's sterile normal sala and bring it out so it is damp but not wet, sabi niya. Same do sa sinabi ko, ganun kadali lang. After the procedure, ganyan. Yung cotton tip na nasa natin, pupunasan niyo lang po yung gilid. Gilid ng sugat. Para mapunasan lang yung mga basang part, yung pinag-irrigate natin kanina din. Continue until all wound surface are in contact with gauze. Sabi, do not pack too tightly, wag po masikip. Do not overlap wood edges with wet packing. So, kailangan dry po mga bunso, Then, apply an appropriate outer dry dressing depending on the frequency of the dressing changes and the amount of exudate from the wound. Parang ganyan lang naman bunso. Sakto lang. Kailangan sakto lang. Then, huwag masikip. Ganyan. Para lang ma-avoid natin cross-contamination. Ganyan. Then, after all the procedure, pag natapos mo na gawin yung dapat mong gawin, yung pag-discard ng supplies, always remember that. Then, remove yung mga kasuotan, then perform hand hygiene na. Then, assist the patient to comfort. Hindi lang yung iiwan mo siyang ganyan lang, basta-basta. So, na-discard mo na, tanggal mo na yung mga drapes, ganyan. Natapon mo na yung mga infectious, mga ginamit ni patient. Then, assist the patient to a comfortable position as if they have any questions and thank them for their time, sabi niya. Then document the procedure. I-document niyo yung mga before, during, and after the wound assessment. Then yung mga ginamit mong mga kagamitan. Then patient response to the irrigation dressing change. Tapos report any concerns according to our agency policy, sabi niya. So, yun lang, ganun kadali lang mga bunso. Basta, always remember yung hand washing, tapos yung kailangan yung tip ng needle or ng syringe, kailangan hindi matouch yung wound pag nag-wound irrigate po tayo. Then, kailangan pag magtanggal po tayo ng OS, pag matigas po upon removing, i-flush lang po natin siya ng solution. Then, pag natanggal na, assess mo yung sugat, kung malalim or pagaling na, ganyan. Or may amoy, or may grabing redness sa side, ganyan. Then, after that, i-perform mo na yung dapat, yung wood irrigation or irrigating, ganyan. Flush tayo, 1 inch yung pagitan, flush, then, pag nakita mo na yun na moist na siya, na clean na siya, na tayo ng cotton swab sa gilid, cotton swab, pag nakita mo na dry na, coveran na po natin siya ng OS, not too tight, sabi diba, not too tight. Yung sakto lang, tsaka tignan nyo kung may pagpasukan, kasi sometimes yan yung pwedeng simulan ng infection pag nakapasok po siya. So, kailangan covered po siya to prevent cross-contamination nga. Then, after the procedure, discard all the items and document. Tanongin mo na si patient kung okay na siya, kung may katanungan. Kung wala naman, magpasalamat ka. Then, document the before, during, and after the procedure and yung mga ginamit niyo po. So, gano'n lang kadali ng mga bunso. Kung may mga katanungan kayo, i-chat niyo po ako. Kung may mga problema, i-chat niyo po ako. Pero pagdating sa pera, wala po ako niyan. So, yun lang naman mga bunso. I hope may natutunan nga kayo kahit saglit na pasada lang yung ginawa natin. So, hoping na ma-meet ko kayo ulit next week. Sana nga kasi sobrang hectic na schedule gawa nga ng COVID. Naway bigyan tayo ng time na ma-meet ko kayo ulit. So, thank you sa time nyo na panoorin nito and ano pa nga ba mga kakulangan? God bless. So, ingat kayo lagi and bye-bye.